the rationale is that we really need some, urgently need some new assets, new strategies for the treatment of small cell lung cancer. Very little change had we noticed in the treatment of small cell lung cancer over the last 3 decades. The significant one maybe is the recent demonstration that chemotherapy in combination with PD-L1 inhibitors, atezolizumab or durvalumab, is improving moderately survival and other efficacy endpoints as compared to chemotherapy. However, the improvement in efficacy is somehow marginal, and we really need some new treatment alternatives for this patient population. And here we have evaluated a new agent, which is a BiTE, a bispecific T-cell engager, which is actually binding on the one hand CD3 and on the lymphocyte, and on the other hand DLL3 on the tumor cell. Okay, so that was a first-in-human study of the AMG 757 that, as we have mentioned, is bispecific T-cell engager binding CD3 and DLL3. In this study, we actually tested a number of doses, starting from 0.003 milligrams up to 30 milligrams, actually, in this presentation. Some of 52 patients were included, and in this presentation, we have updated the safety, but particularly the efficacy results in the patients treated along these 9 dose escalating cohorts. So the key results is that overall the drug is reasonably well tolerated, so that I would say most of the patients do not have severe adverse events. The rate of treatment-related adverse events more than grade 3 is 23%, and grade 4 is 8%. So I would say a pretty reasonably well tolerated regime. Most frequent treatment-related adverse events, which are mild for most of the cases, are fever, tachycardia, nausea, so typical adverse events of cytokine release syndrome, which is typically grade 1 or 2. Only grade 3 were seen in one case, to be honest. The other important results were related to efficacy, and as I said before, along the different dose levels, we have seen responses in some 7 patients, which is about 14% of the patients treated. There are some patients still, in addition, with unconfirmed partial remission or stable disease, and at least initially, it looks like responses are pretty much long-lasting. Well, I think this is an early signal of efficacy and favorable toxicity profile to a drug, which is actually having a new mechanism of action as compared to the strategies that we are using in the practice today in small cell lung cancer. So I think by refining the dose regime and hopefully checking the activity in a cohort of patients with less prior treatment, we may have a good idea of what would be the space of this drug, if any, into the future. It would be particularly interesting to see the efficacy on patients treated with chemo-I of first line. What would be the efficacy of this agent here? it would be important to see as well if this agent could be combined with PD-L1 or PD-1 inhibitors. In that case, we may build in the maintenance phase of chemo of first line by using not only atezolizumab or durvalumab, but some of these PD-L1 agents in combination with the AMG 757 BiTE. And of course, all this answer requires future trials, but I'm sure the data already known warrant for their investigation with this agent.